Here we go. Okay.
Awesome. Make sure you tag me.
I will, definitely. Hi there, I'm Brenda Merritt. I'm the Dean of the Faculty of Health here at Dalhousie University, and we're here for another episode of the Dean's Dialogue. And I have with me today Dr. Kyle Wilby, who is a faculty member in the College of Pharmacy and the incoming director for the college. Welcome, Kyle.
Thanks for having me.
Yeah. So as we have been doing with others, we'll have a set of more formal questions and then some fun rapid fire questions.
Awesome.
Does that sound good?
Yep.
All right, first question. Congratulations on your new role first. But I'm curious, what are your key priorities during your first 100 days as the director of the College of Pharmacy?
That's a great question. I feel like I'm right back in an interview because our mentor told me to read the leadership book the first 90 days, I think it is. And so I think there's a few things because that time period is going to be really critical from July to, I guess that'll get us through September. So number one is to bring in that incoming class to really welcome the next big class of pharmacy. We're having a lot of exciting things happen in pharmacy and really trying to develop the workforce. So we're hoping for a big class that comes in and get them right to orientation to start of classes. We also have a lot happening in terms of graduate programs. So I want to launch needs assessment, looking at our workforce and trying to determine what we can do to enhance our graduate programs, and also aligned with that, really move our research forward. And then I have noticed that some other schools in the Faculty of Health have some social media pages and some interesting things happening. So we're hoping to launch a little bit more visibility, get ourselves out there and really promote the wonderful things our faculty, staff, students, alumni, and partners are doing.
I have heard from some pharmacy alumni who would love to hear more about what's happening, because there is a lot happening in the college.
There's a lot happening.
Well, that's a really full 100 days. So I hope it goes well. Okay, next one. What are some of the unique challenges facing the profession of pharmacy at the moment? And on the flip side, what are some of the opportunities?
Awesome. So pharmacy is in that critical period right now. I think if you're from Nova Scotia, you would have heard about the new primary care clinics that are popping up. There's a lot of scope of practice changes. So what that means is pharmacists are able to do more within our scope. So assessing and prescribing for certain indications like strep throat, urinary tract infections, contraception, and other things. With that comes a lot of development that's happening in the workforce, where we need more pharmacists in these roles because the demand is now on pharmacy, where we're shifting a lot of those primary care responsibilities to your community pharmacy, where you can just walk up in your neighborhood and go receive that care. So with that comes a lot of workforce development. We are seeing a shortage of pharmacists in the Maritimes as a whole, and so really trying to maximize our recruitment at Dalhousie in order to graduate pharmacists to take those roles, and then to capitalize on the expertise of our faculty to help train those that are already in practice, to develop continuing education programming in order to help improve that. Another, I think, critical piece in terms of pharmacy practice is really understanding how that primary care piece is going to fit into our overall professional structure. Nova Scotia is leading the way in Canada. There's a big professional conference in June that I'm going to, where all of the key stakeholders in Nova Scotia are presenting on what's happening here. And so how can we help all Canadians by translating what's going on in the province here across the board?
So it actually sounds like a really exciting time to be a pharmacist right now, and kind of learn some of these new responsibilities and being a really critical healthcare provider for our communities.
Yeah, it's interesting because I always reflect, even when I was in pharmacy school, I don't want to date myself, but over 20 years ago in Saskatchewan, we were always saying, oh, we do so much more than dispensing. But even to this day, I still have conversations with people that still see pharmacists as providers of medications, and we're really product focused, but that's really changed. Pharmacy technicians, pharmacy assistants have changed the game for us. And pharmacists are those people who can really help patients, help the community, understand their primary care needs, and then provide a lot of treatment that you might not have to go to a walk-in clinic or the emergency room department. emergency department room, and we can, really capitalize on our skills and keep people healthy within our communities.
That's excellent. On to the next one here. How do you feel Dalhousie's College of Pharmacy is especially positioned to meet these challenges and needs of our community and the profession?
Yeah, so Dalhousie is interesting because in Canada we're the only pharmacy program or pharmacy college that serves more than one province. So there are no pharmacy colleges in Prince Edward Island or New Brunswick, and so our college, of course, serves lots of Nova Scotia, but we do graduates who go to the other provinces, and we really need to capitalize on what's happening in those provinces and understand those provinces in order to help support their needs. Mm-hmm. And I've lived around the world, as I know you know, Brenda. So I've lived I've been in Saskatchewan, British Columbia, Ghana, Qatar, and New Zealand. And I really see the Dal College of Pharmacy as an innovator and as one that is pushing the boundary. So aligned with our colleagues in the profession, our regulator and our associations, we are pushing the boundary on scope of practice and on using new models of training within our program in order to help improve the pharmacist's knowledge and skills upon graduation and then take on more of these advanced roles.
Very proud to be part of this journey with the College of Pharmacy. What would you say to a young person who is considering a career in pharmacy right now?
I'd say we have a website, dal.ca. Google search Dal Pharmacy. I think my advice would be to really take a strong look at pharmacy. It is a profession that provides a great lifestyle, but at the same time allows you to practice as a valued healthcare provider, to make decisions for patients, to prescribe, to diagnose, and to really become that vital, accessible healthcare provider that everybody should have within their circle of care. And that's what we hear. We hear pharmacists are the most acceptable. When the trust list comes out from, I think it's Maclean's magazine, it's pharmacists are always in, sometimes the top 5, sometimes the top 1 of the most trusted professionals within society. And so it really is a profession that is small, but a great community and a great chance to give back to your own communities.
That's excellent. What are some of the things that potential students and or community members may not know or understand about pharmacy?
I touched on on the scope of practice and how that's changing, and I think that's probably the most important thing is even, we joke in the profession ourselves that every day there's something new that pharmacists can do, and that can be stressful at times for the profession to upskill and make sure that we're able to provide those services. But I think really it's the clinical skills that we have and the services we can offer to patients and to the communities. If you're in a pharmacy, go talk to your pharmacist and go ask what sort of services are available, because it might allow you to receive care within that setting versus having to go and make appointments, with your other healthcare professionals.
That's good to know. Last formal question. Right. We're getting through them. You've recently been awarded a CIHR grant for a much-needed pharmacy-based sexual health services project. You have also led a curriculum overhaul in the college to better serve the needs of LGBTQ+ patients. Can you talk about pharmacy's role in contributing to these very important and sometimes overlooked aspects of health?
Yeah, so and that's one thing that's really been so great about Dalhousie. I've been here for 3 years, and these projects have really come to life since my time at Dalhousie. Before that, in New Zealand, I started on my sexual health and 2S LGBTQ+ journey, and coming here, it's really enabled me to take on a lot of these research initiatives. And what I've noticed from my research is that we do have a niche in pharmacy where we are embedded within the communities and the neighborhoods where it's easy just to walk into a community pharmacy and seek care. So for someone who might be from a community such as the 2S LGBTQ+ community, or someone who's seeking sexual health services but doesn't want to go to a sexual health center or to a sexual health clinic where they feel they could maybe have some stigma associated with the reasons why they're going there, having that private consultation with your pharmacist can be a really great way to access that care. So we've realized that there's a lot of pressure on the health workforce in Nova Scotia in particular and the Maritimes, especially in the sexual health world. So we're working with our partners both at Nova Scotia Health, the Halifax Sexual Health Centre, to see what can we do from a pharmacy perspective to help work with our collaborators and relieve that burden on the healthcare system.
And I've been so pleased with the college and our community in embracing some of this new knowledge around serving to us LGBTQ folks, and you've been a huge leader in that, so it's been great to see.
Yeah, I think it's an area for the whole faculty is having some movement in that space, and I think we can do a lot within the health professions to even improve that further.
Good. Are you ready for the fun questions?
I hope so.
Or hopefully these have been fun all along, but these are the less formal questions.
All right.
Okay, first concert you ever attended?
First concert, Red Hot Chili Peppers in Saskatoon, Saskatchewan, 2008.
2008.
I think it was Stadium Arcadium.
Okay. So we'll maybe learn a little bit about your musical preferences here through this. What is something you wish more people knew about you?
I've been to 73 countries. I can speak conversational Japanese and Portuguese.
Oh, I did not know that. Do you have opportunities to speak those other languages frequently?
Not so much anymore. Yeah, hoping to find some conversations.
Party.
Yeah,
because I would think if you don't use it, you lose it. That's what would happen with me. What do you do to relax and take care of yourself?
Definitely the gym, running. That would kind of be my safe place where I really kind of have that meditative moment. I know a lot of people like meditation, but for me it's being active in that space, and there's really nothing like an early morning run, Point Pleasant Park, overlooking the ocean, where you can really just kind of relax, let your mind go to wherever it needs to go, and have that self-care.
Yeah, I am right there with you. Through biking or walking, movement meditations are what work for me and help me relax and sometimes problem solve when you get into that relaxed state. What is the last thing you binge watched, read, or listened to?
Well, it's funny you say you get to know more of my music taste, because I binge listened to all weekend the Tortured Poets Department. Do you know what that is?
I do not.
Well, it's the new Taylor Swift album.
Okay, I'm really putting myself out there because I bet everybody knows what this is and I do not.
And she dropped a double album, so you have 31 new songs to listen to. I can send you a playlist.
Okay.
Otherwise, I've binge watched quite a bit lately because it's exam period, but the TV show Narcos I've never actually watched before, so I've just been through all 3 seasons of that.
That's very nice. And last one, your favorite place you have spent a vacation and what made it special for you?
I'm going to go aligned with my last comment. I was just in Colombia in March and spent just about 10 days there and really loved that country. We went to a few different places and I was just really interested in how different it was from each city we were in. The food was great, the people were awesome, but we would still be able to learn about history, but then also have those beach vibes that we're all looking for on vacation.
Oh, that sounds awesome. I'm a little bit jealous about that. Well, thank you so much for spending some time with me here in the Dean's office, and I really look forward to working with you in your capacity as director.
Awesome. Thank you very much.
Thank you.